work is in the line of a, research trying to identify early biomarkers that correlate with the genetic signature of GBA. And again, there is really a lot of research effort around the world to identify biomarkers in terms of, either the enzymatic level, but also other molecules that can be measured, maybe in the blood, or, in a simple way, so by taking a blood samples or something like that, and that could correlate with what we see in terms of severity of the phenotype, in terms of disease progression, and so on. Or also try to identify early biomarkers of disease conversion in asymptomatic carriers, which is also very, very important, as we mentioned, because when we do counseling, let's say, for instance, an offspring of a patient with GBA variants, we cannot really tell them, okay, you carry this variant, but we cannot predict whether you will or you will not become affected. And obviously, this is a major issue, also psychological for families, so it would really be important to find out. So we're looking, for instance, at synuclein levels in blood, or, there are other studies in the CSF, or, in other cells from the blood as a biomarker, because there is a correlation between GBA activity and the accumulation of, alpha-synuclein or specific forms of alpha-synuclein, as well as other markers coming from lysosomes, for instance, because GBA is a lysosomal enzyme, and there are a number of studies showing that lysosomes may not be working properly, and therefore, by looking at specific molecules that should go into this pathway, can serve as a biomarker. And also there are interesting studies in the field of neuroimaging, and using advanced neuroimaging as a tool to, detect early changes that may help differentiate these different groups of patients even before the clinical signs are manifesting. So, I'm sure in the coming years, we'll be seeing a lot in terms of, biomarkers or imaging biomarkers, and we'll understand more about subgrouping the GBA population according not only to the type of mutation, not only to the phenotype, but also according to these different biomarkers that are being studied.